All right, let's talk about, this came out right after we recorded last, and it really hit close to home for me because, and I think any doctor, because we deal with this all the time. This is an article from the Globe, March 17, 2025. Partners and brothers, after a big donor sought care at Dana-Farber doctor, from a Dana-Farber doctor, things ran away. This is a story of a man named Mark Cohen, who is a patient that had multiple myeloma, which is a kind of blood cancer. And for 10 years, he got really concierge-level care from an oncologist at Dana-Farber, a world-renowned oncologist named Dr. Kenneth Anderson, who really is one of the best in the world at what he does. And there was emails, there was texts, weekends, nights, holidays. Nothing was off limits in terms of the access to Dr. Anderson that Mr. Cohen got. I should mention Mr. Cohen was on the board at Dana-Farber, which is what allowed him this amazing access. And after this patient unfortunately passed away, the patient's brother is now suing the doctor, saying that he didn't keep adequate medical records of the care that he provided to Mr. Cohen. And I mean, you talk about no good deed going unpunished. This guy gave concierge level care, this oncologist, to this unfortunate gentleman that, frankly, I mean, look at thousands of people get diagnosed with multiple myeloma in this country every year, and they're not getting access to their oncologist like this generally. This guy did because he was on that board. And, to go back and get sued about that because you didn't keep a record, it's a lesson to all of us, right? Because we're all being constantly asked to do favors for people. I am asked to do favors for people every day of my life. People calling me on my first personal phone saying I need X, Y, or Z, or I have X, Y, or Z wrong with them. And do you know what I've learned over the years, David? That only except in the most extreme cases where it's like a true emergency, that I really need to funnel these people back into the proper channels.
Right.
Through my office.
Yeah.
Because otherwise it gets messy, it gets confusing. I don't have a record. 8 months from now, oh, remember you gave me Augmentin for my sinuses and now I have that diarrhea and I'm wondering, well, no, I don't. I remember that. And there's no note written about it. So there's no record of it, right? That's terrible medical care. So this story is a lesson, first of all, to all physicians that there is a method to the madness of a way a medical office works, and we got to try and stay inside those proper channels when we can.
Interesting. Your take is obviously really good advice. This like a trap for the unwary for the physician, but to someone sort of outside of it like me, I say I feel for the doctor.
Yeah.
The doctor was probably going out of his way and I think definitely going out of his way. He was acquainted with this patient. They might have been very good friends for all we can tell, right? But it was this sort of casual thing. And I wonder if the doctor in the back of his mind thought, well, I'm going to, send every last email, every last text. I might not keep all the records, but, this is someone I know. It's not like this person is going to sue me.
Right.
And of course, what happens?
Right.
Yeah.
I tell my staff this all the time because it's like, yeah, everyone's friendly and nice until something goes wrong.
Yeah.
And something bad happens. And then it's all hands on deck. You never know how people are going to react to the loss of a loved one, to a bill that they're not expecting, to anything like any unexpected news. You never know how quickly those quote unquote friendships and favor seekers that can wash away in a second. So everything, and it's just good medical care too, to keep a record and to keep everything in the proper channels.
Sure.
So I push everything in, even for my mother calls me and I'll be like, I think I have UTI. Okay, I got to write a note, Mom. I got to put you in for a telehealth visit and write a note. I don't have to bill it, but I have to write the note because if I don't do that, it's not good medical care. And I do feel bad for the oncologist too, because I mean, trust me, he's not the only one that does this. We all do this. We all do this.
Well, let's not forget that we don't know apparently from this report what the whether there was actual negligence or not. Now, I guess what they're saying is there's negligence in and of itself and not keeping proper records.
That's what they're saying.
Okay, but all right.
But
I mean, I have a law degree, and I don't want to throw lawyers under the bus, but I'd really like to know: does this suit really have merit, given that we don't know whether he died of COVID apparently,
Right.
And so, was his death really avoidable if the medical records have been properly kept? I don't know.
No. I mean, honestly, first of all, the care for multiple myeloma has revolutionized in the last 5 years. It's a different disease than it used to be because it used to be tough. This guy, when he was diagnosed, I think it was sometime maybe 15 years from the time of diagnosis to the time of death. And I mean, to live 15 years with multiple myeloma from the early 2000s to 2022, that's not a bad outcome at that time. I think now you're seeing more and more people living long like that and maybe even longer with it because the treatment's gotten so much better. But for the time he got it, I mean, he had a pretty good outcome in the grand scheme of things.
Yeah.
So it's tough. It sounds like you got great care from a doctor that was totally invested and committed and literally giving his all his personal time and I mean, the story actually notes weekends, holidays, everything, and just to get burned by that, I mean that is tough. So it's a lesson for all doctors out there. Keep it in the proper channels. That's the right way to do it. You can still give people great care.